So those who are present can write about your problems. Listening part C. Listening part C difficulties, you can write. What are the difficulties that you are facing with listening part C? What are the problems that you are facing with listening part C? Please mention. The problems you face in listening part C. What are the problems that you are facing? Write down your problems. Yes. Number count is 10. Come on, write down your problems. All your problems related to reading and listening. Yes. Sangeeta Patel, difficulties in listening audio with answers analysis. Not able to understand an overall idea. Simol Thomas. So today you should be very clear regarding part C. All the different techniques. So difficulty in finding answers, not knowing the synonyms and how to correlate. With the Questions and options. Okay, good. Marnag. Inability to pick common synonyms within the options, inability to connect the audio and options, getting lost within the audio. Good. Shifali, difficulty in finding answers. Yes. If only one person is talking, it's hard for me to follow when he switches to the next question. That's right. There's a lecture. Yes, 13 members. Monologue, listening topics are tough. Yeah, there's a lecture. Monologue is a lecture, dialogue is a interview. Good. So write some more problems. Think, think. Because we are going into a stretch now. We are not going to delay. Okay. We're going super fast. Already I've explained you the functionalities. Okay. Yes. Yeah. Those are very dynamic. Make notes. Anvi Jacob, what happened to you? Why were you absent in the previous session? Very important session I have explained. Anvi Jacob. I was searching for you that time. I sent you the link personally also. Hello, Anvi. Anvi Jacob.
Yes, sir.
What happened?
Yes, I watched that in the YouTube.
You watched in the YouTube. Very good. That at least you did. That's a very good job. Okay, I really appreciate you. Okay, so that's really appreciated.
Yes, sir.
Yeah, you can mute back. So make notes because I'm going to give you, these will be useful for not only in the reading and listening, because I'm going to prepare you mentally, then afterwards we'll go into the listening. Yes. Yeah. Right. Most of the things which we have discussed earlier will already be there. So we are not going to learn too many new things, very few. because we have gone into the depth of the subject. So now second one. Secondary suicide prevention is understated. Understated. Okay, this is very important word. Understated. Secondary suicide prevention is understated because is the key word. Here as is the key word. This is the danger signal. Because means he is asking the reason. As means similar to is comparing here. Okay. So, all right. It is only starting to be applied in practice. Starting. It's in the starting stage. It is in the trial period, only starting to be applied in practice. That means only theory earlier. Now no practice. So this is how you have to read. I'll explain you. So these are important words. So only starting means in the beginning stage, means trial place. So earlier only, now till now only theory, no practical experience regarding it. Suicide is difficult to predict. This is prediction. Difficult to predict. Difficulty to predict. Guess. Okay, recent events led to increased suicide. Okay, recent events. Okay. Recent events means occurrences. So these are the keywords here. Understated is question because means he's asking the reason. What is the reason? Just a new or guessing or events. So this is how it is. Okay. Right. Next one. Mary talks on the importance of suicide assessment because many questions are reason-based question. Cause and effect. This is called as cause and effect. Cause and effect. Because ringing the dangerous bells. So important because. Important because. Try to understand the importance here. Importance on suicide assessment. So he's talking about the assessment. Means evaluation. What is this assessment? Psychiatric illness is a major contributing factor because means reason. Factor. So psychiatric illness. This is about psychiatric means mental. This is about mental. It enables in the identification of the risk factors and identification. Keyword. It helps develop diagnosis and treatment. Diagnosis and treatment method. So diagnosis and treatment. So anyone you can say. So diagnosis, if you can diagnose, then you can treat. Okay. So what must be done? What must be done in the future for subjective rating of severity of depression? This is related to depression. Subjective rating of severity of depression. This is the question is about depression. The question is about depression. So the question is what must be done? So what means what implementation, what effect, what should we do? So what is the solution? This is what must be done means solution. What must be done means solution. Write down all the things whichever I'm saying. What must be done means solution it is. He's asking solution. This is the problem. Depression is a problem. So solution is asking. Try to understand this is a problem, solution question. Whatever I'm writing, somebody write important things. Whatever I'm saying, write down these important things. Shifali, write down. Sangeeta, write down. Rumbi Zai, you got the result, na? Rubina, write down. Whatever I'm telling you, whatever notes which I'm telling you. Oh, did I put for live stream? Yeah, live stream is there. So, what must be done for depression? Subjective rating of severity of depression. Physicians should not hesitate to ask on suicidal ideation. Physicians should not hesitate to ask on suicidal ideation. Okay. clinicians need to overcome obstacles. This is obstacles. Overcoming these problems. Okay. So no hesitation. Physician should not hesitate to ask on suicide. So information gathering, asking, information gathering here. Ask means find out information, means information gathering. So additional information should be incorporated. Additional information should be incorporated into assessment. This is assessment. Okay. So this is information gathering. This is assessing the information. This is problems to get this treatment. So this is before assessment. This is assessment. This is after assessment. Care is after assessment. So like that you have to separate. Okay, we'll come back to it again. I'm just giving you some important words I'm gathering for you. Mary feels that suicide rates may be reduced by interventions. So interventions, what type of interventions? What type of interventions can be given? Like means as, means examples. Earlier we have seen the word as. First question we have seen as. As is the danger, say intersection. Yeah, like means as. So you have remember the first question, the very first question. So here as means like. You see here, prevention is as means like means similar to. Already was this question we have seen. So this instead of as he's telling like, as means like means same to same, similar. Okay. So you have to understand the relation of these words. So Mary feels that suicides may be reduced by interventions. So role of interventions here. What are the, which type, like means which type of interventions? Like similar to means type, like means type. Okay. And 35. So one more is a legal restrictions. This is legality. Okay, that reduce access to harmless substance. Legal restrictions that reduce access to harmless substances. This is legal restrictions. Legal. Okay, this is law related. Psychological follow-up. This is psychological. And this is therapies that address repetition. These are therapies. Okay. Right. Therapies. What is the increasing concern? The word is concern. You should know what type of words are important in the question. Okay, what is the increasing concern with the digital media covering suicide? What is the increasing concern with digital media covering suicide? So negativity. Okay, there are still many gaps in the research. Many gaps means lacks, means deficit. Gaps means drawbacks, deficits. Okay, insufficient information. It glamorizes suicide. Glamorizes suicide means making hero worship. You should remember all these things. Almost making vulnerable. Okay, it glamorizes suicide, almost vulnerable. Somebody jumps from top, that means they were becoming hero, like that one. People are seeing. So let everyone see, I'm also going to kill myself, like that one. Okay. So let the world know, at least in death people will realize me, like that one. So glamorizes. It provides accessible information for an attempt. It provides accessible information, accessibility. So these are the important words. Every sentence, you will have one important word. Research is not important. Gaps in the research, drawbacks in the research, deficit in the lack. Okay, minus points. Okay, insufficient information. So all these things. Glamorizes, hero worship. Okay, promoting, propaganda. Okay, accessible, reach, available. Okay, so like this. Now I'm going to give you, activate your vocabulary. I'm going to activate your vocabulary. Get ready now. Yes. Come on. I'm giving you time, hit the button. Okay. I'm going to give you time, hit the button, mentally activating your vocabulary. Mentally activating your vocabulary. First, if you understand this vocabulary, you should know You should be a power bank of vocabulary. So we are activating our vocabulary first. Right. Okay. On the left side. Okay. I'm keeping my margin here. I'll be giving the words. Then what you have to do is write as many words related to that one. Forget about others writing. You write. Don't even bother about the others. Don't even bother about the others. Don't even bother about the others. We are least bothered about the others. Here I am in front of you. So I am there. Look forward to me. No need to bother about others. Okay. I'm activating your power bank. Okay. First one is everywhere you see these words. So the first word is describes. I will write in capital letters, but you write all small letters. Describe. No need S. Describe. The first word, number one word. Describe. Describe. Yeah. Come on. Activate. Selvi Aru not opening. What is not opening? Yes, come on, write down, don't stop. Don't stop. How many words you know you learn? Write down. If today you're not, see in the practice, you don't practice rehearsals, then you'll go and die in the war there. Better die now, suffer now, then die later. Try to avoid capital letters as far as possible. Try to write all the synonyms you know. Describe, explain, portray, elaborate, explain, analyze. Write down whatever it is. Illustrate, portray, simplify, analyze, demonstrate, explain, describe in detail. Write down whatever you want to write. Rather than suffer later, suffer now. Learn now rather than fail afterwards. Those who don't practice, they'll fail in the exam. Those who don't learn, they fail in the exam. It is no child's play. Yes. So there will be like this. Next one is number 2. If you don't know, copy all from others and write again. Copy all from others and write again. Write in your notebook or write whatever it is. Afterwards, I'm going to put it in the Telegram channel and we are going to collect these things. Yes. Stop. Whatever you have posted. Because I'm giving you the second word. Because these words which I am giving you will come in each and every test. Each and every test they will come. So stop. Now next one, number 2 is here. Number 2, purpose. Purpose, reason, goal, aims, objectives, factors. Why? Because. Therefore, so, hence, since, due to, owing to, because of. I can tell you just like that, but at least you have to write and learn. See that all the words that I have written, spoken are there. Purpose. You think in the first question purpose is there, it is not there in the second, it is there in the second question. It is there in a different form. Purpose means reason. Reason means because of. Because of means why. Second question, it is there, but the shape is changed. Only you have to identify, open your eyes. For example, your name is Neha Banu. Neha Banu is a daughter. Neha Banu is a nurse. Neha Banu is a sister. Neha Banu is a friend. Neha Banu is a student. For me, she is a student. For her mother, she is a daughter. For her sister, for her brother, she is a sister. For a friend, she is a friend. Different types of names for the same person, Neha. Everyone sees Neha, but they call them different names. It doesn't mean that they are different. All the labels are for one thing. So they change their shape. They're called in different ways by different situations, different occasions. Words change according to person, place, time, and situation. That is what I'm showing you. First question, he said purpose. Now, second question I'm changing into purpose. See here. What is the purpose of secondary suicide intervention? That's it. What is the purpose for understating secondary suicide prevention? The same question in a different phase.
Abhinav.
Is that HP? HP, write your name. See, Oppo, write your name. HP, I'm naming you as first and second. I want your first name and second name. Oppo. I am writing your name as 1 and 2. I need your names, please. I don't want phones to be here. I want people to be here. So please submit your names. That's very important for me. Yeah. All of you regular students, submit your names for attendance purpose. Yeah. So, right. So, purpose, 1, 2, raise the hand. Yeah, type your name, please. Type your name, please. Only messaging. Only messaging. Mics will not be open. Now, this is my time. Only in the question answer session, the mics will be open. So please, whatever it is there, you can type here. Yeah. So first, second, type your name. 1, 2, type your name. One, two is Selvi Aru. Very good. That's it. When I can manage without opening the mic, I'll open like that only. So 1, 2 is Selvi Aru. Very good. Oppo. Type your name, please. That is first, second. Please type your name. Right. And then, so first, second is Rachana. Rachana, very good. Thank you. Whenever you come, next time come with your name. When you are entering itself, what name you are giving, they have to give there so that it will be easy for you to identify. Because some people, you know, they put artificial intelligence and it obstructs. I have faced 1 or 2 times like that one. So this is Rachana. First, second. Yeah. So write the first name and second name, Rachana, Rachana. Okay. That's it. Okay. Now, so purpose. Shape is different. Purpose. In another question, it say why. In another question, say the reason. In another question, it's the same thing in a different disguise. It changes shape. When you go to your mother, you're a daughter. When you go to your brother, you are a sister. When you go to your friend, you are a friend. When you are going to teacher, you're a student. When you are going to your student, you are a teacher. When you are going to your patient, you are a nurse. When you are going to your doctor, you are an assistant. So try to understand that is how words play a different role. That's it. Now let us see here. Next one, number 3. Number 3 is prevention. Now what is prevention? Obstruction, avoidance, avoid, obstruct, hinder, stop, refrain, restrain, restrict, censor, object, control, prohibit. How many words again? I don't know what words I have spoken just. If I want to recall, I cannot recall. They come like a force like that one. Afterwards, I don't even remember. Don't expect me to remember and tell all this because I cannot. Once again, I have to go into the flow, then I can get. Prohibit, restrict, avoid, control, stop, forbid. New words will come now. Next time. Old words may be missing. Some old words will be lost. Forbid, obstruct, refrain, restrain, restrict, control, censor, object, withhold. See, new words are coming. New words are coming. New words are coming. Old words will not be there, maybe. Sometimes old words are missed and new words will be coming because that is how it goes. Withhold is one word, Rubina, not 2 words. Double H, W-I-T-H, H-O-L-D, double word, one word, finished. Yes. Afterwards, what you do is, take one word, I put the words there already. Collect those words and put there. Yes, I'm giving you 3 minutes. I'm giving you 3 minutes, everyone. If you love your friends, go get them here. Give them free, everyone, today. Yes. Send the link to your friends. Take 3 minutes, send the link to your friends. Let them also come and learn. One person brings one person, halt. Yeah, halt. Stop, see? Forbid, F-O-R-B-I-D, shahala, forbid. Three minutes. Get your friends. A number of people who are just wasting their time. Ask them to come. You don't love your friends? Don't be selfish. Be generous. Be generous. I'm an example for you. If I want to give 1, I'll give 10. If you love somebody, you will go to whatever extent to support them. Go, do something. Even if one person brings one person, then it will be 50. United we stand, divided we fall. If anybody, any nurse is there without any work, let me know. We need some assistance for online posting. Like how Ashwini is doing. Ashwini is working from morning 9 o'clock to evening 6 o'clock. After 6, I need 6 o'clock to 12 o'clock. I need somebody, if anybody is there, just to post whatever. See, I'm sending to everyone like that. Somebody can help me. So they will be paid salaries. Yeah. Right. So next one. So any increase in the number? 23 still. Okay, fine. Come on, come on. One more minute, last minute. Take time. Take time. So I'm going to give you pairs now. Tomorrow I'm going to give you pairs. I'm going to give you pairs. And don't talk rubbish and nonsense with others when I'm giving you pairs, please. Because they will tell me automatically. Some people go and talk this, that, this, all nonsense. Okay? So don't do that one because I'm going to give you pairs. Beautiful pairs I'll give. Like one person, they can do participate in speaking practice or something like that. So last minute. Somebody has invited you, so you came and joined my group. Otherwise, you cannot join my group. Somebody blessed you, you bless somebody else, no? Like that. When I give open free sessions, you can bless others. All right. Yeah. That's now next one. Next one is number 3, 4. Number 4. So prevention we have seen now. Okay. Next, number 4. Describes purpose prevention. Next one. Reduce. Reduce. Minimize. Deteriorate. Disintegrate. Short. Fall short. Okay. Go down. Drop. Decrease. Disintegrate. Deteriorate. Come down. Minimize. Lessen. Write down whatever you want to write. You are very powerful. You know a lot of things. Lessen. Subtract. Lowered. Plunged. Submerged. Fell down. Reduced. Minimized. Deteriorated. Disintegrated. Become less. Jump down. So a lot of words, any word may come there. Only the thing is how activation. Why others, some people get answer, why others cannot get? Because their mind will like a run like mercury. Mercury, you just put it down, it flows everywhere, mercury. It will not stop in one place. That's good, Neha Banu. That's good, Shahalla. Yes. Next. These words which you are doing today, tomorrow you will dance when you come. Relate these words. Question. One word. This is easy. This paper is little bit easy. This is not that tough. It will be very easy when you identify your question with your audio in future. Today you are working a little hard, but tomorrow it will be pleasurable moment. Today you suffer, tomorrow you dance. Today you relax, tomorrow you suffer. That's it. This is lifestyle. Next, number 5, number. Number. values, statistics, data, information, survey, analysis, figures, ratios, proportions. Statistics, data, ratio, proportions, numbers, figures, values. Proportion, not proposition, proportion. Proportion, proportion. Percentage. See, I only don't get sometimes, afterwards I'll get. Percentages. Shares. Higher share, larger share, like that one. Figures, values, yeah, portion. See, Nasra has given another word, portion. Good. I told proportion, but she told portion. Portion is a new word, yeah, part. Then next one. Come on, come on, come on. Guess some new word may come there. Next. Number 6. Number 6 is new. New. Novel. Stranger. Surprise. Shock. Alarm. That means new. Something new that is shocking. Okay. When you find something new, it will be shocking or alarming or appalling or surprising. Okay. New things. Related words I'm telling you. No, synonymous. Yes, there is latest, recent. Very good. Rachna has given latest. I'm telling now recent. I only don't know, remember immediately. See, one word she has given latest, then I said recent. Modern, up to date, updated. Yeah, very good. So when you see one word immediately, they should go. That is called expert. I told you an example now. One is Simon is a nurse, one is Peter is a nurse, one is Neha is a nurse. I told you before. Okay. Next one, number 7. So reduce, bring down, minimize. See earlier, see there only 3 words are there. So next one, bring down, we already finished. Okay. Attempts. Attempts. Trials. Attempts, trials. Experiments. Practices. Performances. Shows. Exhibitions. Just 6 questions we are learning. That is the rapid rate you will learn. This will be useful in your reading and listening as well. Yeah, effort. See, Sangeeta Patel. I don't know effort. I know, but I did not get that word. Sangeeta has given. Good. Try, trial, endeavor, endeavor. See, a great word. I got a very tough word, but easy word. Effort I did not get. What is the meaning of endeavor? How come this word came into the mouth of Simon? Endeavor. To try to do something. See one word. Why don't you use this one in your speaking? Why don't you use this one in your writing? See the powerful word. Try is A1. Yeah, seek, strive. Very good. Struggles, attempts. Yeah, try. If you take the word try, try is just A1. Will we give you A2? Try is just A2. Venture. See, Bin Simol has hit another word. Venture. Set out. See, this is how we learn. I am not doing anything. I am not teaching you anything. You don't know that. You think I am teaching you. No, 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 no. What I am doing is I'm just staying in between and I'm becoming a medium where you will learn from one another. That is what you are doing here. If I teach all these things tomorrow, I will not live only. That much pain will be there for me. Yes, RJ. Who is RJ? Tell me your name, please. Write your name. Sonal. Good. New students are there. Many people don't know what we are doing. But experiment. Wow, that's wonderful. Really excellent. Tresia. Tomorrow, you people, those people who are practicing here, Ruchira Joshi, very good. So, tomorrow, these people who are practicing will definitely, you will definitely get A grade or at least B plus, not B grade. B grade, I want to pass, I want to pass, I want to pass is for those ordinary people. You are special people. Sacrificing your sleep and studying here. Okay, hard work. Industriousness. Being industrious is the name of the game. Okay. Right. So next, I don't know what number I'm giving. I don't know. I don't remember exactly. So try. Which number? 7, 8. Yeah. Eighth word. Area. 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 Continent, region, country, location, site, state, division. Place, division, district, county, city, town, village. See, these are all related to areas. Even the direction south, north, that is also area. North, south, east, west, that is also area. In an area, in the north, zone, ZON is zone, field. Yeah, see, field is come there. I did not say about the word field. Yeah, sector is there, quarter is there, see. Locality, locale, LOCALE, locale. So all different words. Today you are suffering, one day you suffer, from tomorrow onwards you will dance. Domain, Shifali, wonderful, wonderful. See, Shifali has taught us one word. Everyone is powerful. Everyone knows some one word or the other word. Put it there so that we'll bring every collaboration. We are working in unison. Unitedly, we are working here. So see, attempts came again. No need, then finished. Then next one. Secondary suicide prevention already came. Understated. Next one is understated. Understated. Next one. Yeah, see, Tracy has given neighborhood. So like this, territory. Rakesh Kumar says territory. Very good. Mona says space. City center. Okay. Frontier. Another word, frontiers. So like that. Boundaries. Boundaries. So now next one is understated. 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 Underrated. Ignored. Not given importance. Underprivileged. Underestimated. Given low grade. Not given priority. Unprioritized. Unprioritized. Less significant. Insignificant. Insignificant. Sidelined. Sidelined. Understated. Sidelined. Next one. Yeah. Underreported. Unidentified. Less focused.
म्हणजे जर चुकून जर त्या लोकांनी बोलवलं एंट्री टाकली म्हणून तर त्यांना सांगायचं की मंडेला
Yes. Next. Understood. Because. Already we said because. What is because? Already we have seen in the previous one. What is that? Purpose. Purpose means because. What is the purpose of this class? Why is this class? What for is this class? What for means why? Purpose. What is the reason for this class? What is the cause for this class? What is the goal of this class? What is the objective of this class? What is the aim of this class? What is the target of this class? That is because. Because is the same thing. Already we have discussed. Because, cause, reason, factor, aim, objective, goal, reason, because, why, cause, because, due to, owing to, on account of, therefore, hence, since, so, as you want to pass the OET, you are preparing, you are attending the class. You want to pass the OET, therefore you are attending the class. Why are you attending the class? Is because you want to pass the class. You want to pass the class, so you are attending these sessions. As you want to succeed in the OET, you are attending the class. You are attending the class so that you will succeed in the exams. Everything is one and the same. Yeah, that's why. Therefore, so Next. Only. Now, what is this only, sir? What do you mean by only, sir? Limited, restricted. Come on, write down. Think you will get a lot of things. Only. Limited, restricted, controlled, not others. Curtailed, very good. See the word bless Jose, wonderful. Where did you go bless Jose all these days? To bless somebody else, bless me, come and attend. You'll get good results and you'll tell many other students, go to Simon sir. Bless me, don't bless others. Curtail, wonderful. Yeah, singled out. Separate. Distinct. Segregate. Select. Priority. These sessions are only for those students who are really serious. That means this is limited. Yes. Wonderful. Come on, write down whatever it is. Whether it is right or wrong is not important. Activation of the brain is more important. No need that all the people will win. At least participation is half one. Selective. Bounded, limited, only, boundary. Yeah, very good. Yeah, loan. Yes. The next one. Number 11. Start. Next one, number 11, start. Commence, begin, initiate. Come on, a lot of words are there. Resume means continue, Mona. Resume means continue. Begin, initiate, start, commence. Genesis, origination, origin. Alpha, establish. Founding, founding member, founding. Foundation. Basis. Yeah, see, kick off, set up, very good, wonderful. Introduce, wonderful. Wonderful. Create, very good. Rakil, no need to worry. We are going to get everything. This is very, very important. Especially for you, it is very important because you don't have time. Inception, wonderful word. Bin Simol. Be on my side. Okay. Be on my side. This is how you learn. Cornerstone, very good. Right. Depart. Departure. Okay. Now, next one is emergence. Wonderful. Emerge. See how words are coming up. These words are C1, C2 now. Emerge is not an ordinary word. If I do not make you think, you will not get this word. Emerge. What type of word you see there? Okay. B2. Emergence. Emergence. Okay. Emerging. Starting to exist. See, powerful word. Evolution. Evolve. Another word. So next one. All these words you will find in all the other tests tomorrow onwards. You will need not worry about anything because your brain will be equipped with everything. Next one, applied. Next one is applied. Apply or application. Application. Yes. Implementation. Yes. Procedure. Strategy. Technique. Process. Steps, measures. Utilization. Organization, management. Next one, practice. Practice. Practice means that same thing. Okay. Reality. Practice means reality. Theory means imagination. Practice, reality, training. Yes. Applied, implication. Yes, that is what it is. Exercise. Good. Come on. Come on. Activity. Very good. Come on. You're doing wonderfully well. Nobody is going to stop you. Dance the tide. Dance the day. Tomorrow you'll be very happy. I'm a hard taskmaster. Okay. But an outstanding paymaster. I will squeeze lot of work from you. But when you get your results, then you will understand what it is. And next one is here. Difficult. Same words will come for you in the exam. Difficult. Difficult. Hard. Strenuous. Come on, you know a lot of words. Why should I tell you? Daunting. Very good, Mona. Excellent word. Herculean task. Tough. Rigorous. Painful. Worrisome. Problematic. EM, problematic. Rewrite the spelling correctly. Problematic. Laborious. Wonderful. Wonderful. Painstaking. Painstakingly. Industrious. Hard work. Risky. Troublesome. Yes. These words will come in the next questions. You see. The next one, predict. Next one is predict. Assume. Assumption. Guess. Come on, write down now. Anticipation, wonderful word. Neha Banu is crazily wise, but she doesn't use all these things. What to do? Now she'll be very happy. If I shout also, she'll be very happy now. Because she's learning something. Huh? How many speculation? See what are the words she is using. Huh? If you come like this regularly, whenever I call, you people will learn a lot. Imagine. Expect. Expectation. Wonderful. Come on. Wonderful. Go on. Dance the tide. You are my children. You'll do miracles now. Smita Kanta came up. Very good. Estimate, wonderful Shahla. Not foresee, Maimuna, foresee. F-O-R-E-S-E-E, foresee. Project. Shifali, you are giving me shocks. Adumbrate. I don't know this word. Wonderful. See, students are there who are showing you new words to teachers only. You can understand. That's it. I don't know this word. This is first for me. This is a novel word for me. Adumbrate, to give only the main facts and not the details about something, especially something that will happen in the future. Wonderful word. Shalla, is that was given this word first? Yeah, you have given me goosebumps now. I don't know whoever has given this word, adumbrate. Shifali, yeah. Wonderful. See, this is formal word. This is formal word, very high level word. Okay. So next. It did not come suddenly to her. She knows that word, so she has written. Even I did not know that word. There is no problem if I accept what I don't know. Because no man is a master of everything. Some people boast, I know everything. But that everything is limited. Okay, that everything is limited. Limited to only his circle, whatever he knows. Beyond that one, he is a nothing. A mathematician, world famous mathematician, is a nothing in Latin. He is a zero in physics. He is a null and void in music. That's it. Next. Yeah, see, envision. Very good. One more word. Estimate. Next one. Now see here, due to. Due to means because of. On account of. See, due to, another word has come here. Due to means reason. Due to means cause. We need not think about it. Now already the words are coming here. Due to means because of. We have already learned. Complex. Complex means difficult. Okay. Not simple. Okay. Recent. Just now we have seen now one word. Recent means latest. We have already gone through this. Now next one. Events. Events. In the event of circumstances, conditions, situations. Write down now, come on. Incident, see. Lot of words will come. Come on, write down whatever you know, write down. Occurrences. Current events, current affairs, see. Incidents, very good. Episodes, very good. Come on. Blast your head. Now or never. Increased. Same word. Lead. Lead. Next one is lead. Lead. Transport. Convey. Transfer. Shift. Come on, write down, start. Conduct. Guide. Yes, very good. Next one. Talks, discussions. Hello, Sarah. Hello, how are you? Yeah, I'm fine, dear. I'm fine. Okay, 11:30 will be our session. Okay.
Yes.
Yeah, I'm in the middle. I'm in the middle of a session. I cannot talk much. Okay?
Sure.
If anything is there, message in.
Thanks a lot.
Yes, thank you, dear. Yes. Now, next one. 18. 18 is talk, discussion, convey, lecture, speech, conversation, communication, message, dialogue, monologue, not a massage, message, Shahla. A debate, yeah, words are coming. Come on, come on, come on. Chat, right? Whatever you get, you write, no problem. Presentation. Next one. Interview, meeting, meeting, yes. Yes, wonderful. Number 19 is importance, prominence, priority, highlight, underline, importance, crucial, very good, fundamental, basis, pivotal. Okay. Compulsory, essential, yeah, essential, principal, primary, indispensable, very good, very good. Key, yeah, very good. Focus, focus, focal, assessment, assessment, evaluation, examination, study, research, analysis. Come on, write down. Diagnose, assess, find out, discover. Evaluate, Estimate. Now see again, because came here. Now all the words will start repeating, starts repeating. Finished. Only just 2 questions we have seen and everything will be repeated now. Now see here, psychiatric illness. Okay, psychiatric, mental, gray matter, brain. So 21, psychiatric, mental, gray matter, brain, cranial. So illness, sickness, disability, helplessness, ailment, disease. Yeah. Come on, write down whatever you want to write. Ailment, A-I-L-M-E-N-T, ailment, A-I-L-M-E-N-T, ailment. Ailment. You have to understand the words. Yeah, mental means lunatic. Yeah, that mad, crazy. So these words will be, they will speak like that one only. Yes, next one. Illness. Sick, unwell. Weakness. Physical disability. Unfit. Very good. Insane, madness. That is for. Okay, next one. Major. Come on, large. Great, greater, more, higher, extreme, huge, gigantic. Expansive, excessive, unlimited. Large. Almost full. Greater proportion. Next one. Contributing. We got the word. Earlier I told lead to. Write down to that word, add to that one, contributing. New word has come here. Contributing means lead to. Contribute means lead to. Contribute means lead to. See, factor has come now. Their cause has come. Reason has come. Because has come. Now factor is come there. See how the words are coming. Contributing. Yes, 25. Enable. Enable. Support. Help. Empower. Very good. Maimuna. Allow. Help. Support. Strengthen. Enforce. Provide an opportunity. Permit. Allow. Not enforce. 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 Shall. Give way to. Provide an opportunity. Open up chances. Number 26. Identification. 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 Understand, comprehend, know, gain wisdom, recognize, recognition, select, understand, comprehend, figure it out, figure it out. Next one. Earlier we have written problem. That time we did not got the word risk, but now the word risk has come here. 28. Risk. Now let us add this word to that one. Come on, risk. 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 Danger, hazard, hazard, complication, harm, threat. Come on, write down. Think just one, 2 seconds. You think you'll get words. Don't stop. Peril, yeah. Tribulation. 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 Any word may be asked. A problem or a difficulty. See, it's very formal word. Very formal word. See here. Synonym is trial. Trials and tribulations. A problem of difficulty. Now see, factors has come. Helps means enables. Develop. Yeah, another word is there here. 28. Develop. Promote. Create. Originate. Develop. Progress. Grow. Enhancement. Build. Yeah, very good. enhancement, increase, multiply, words will repeat, started repeating now. Next one, diagnosis, we already have seen here. Then treatment, 28. Treatment, treatment, come on. Therapy, cure, prevention, no, cure, management, next one is 29. Methods, approaches, strategies, styles, ways. Yeah. Different method, different plans. Routes. ROUTES, routes. Yes. What must be done? What must be done? What must be done means a solution. See, we got another word now here, 30, solution. Solution. What must be done? The meaning of solution is what must be done. Problem solution. Answer, response, answer, response. Write down. Solution means what is the solution, what is the answer, what is the response? Decision, Sandamale, DECI. Solution means answer, response. Nobody wrote, so I'm writing. Yeah. Reaction. The next one. Rating. Rating means assessment. So that is already done. Severity. 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 Seriousness. Complication. Urgency. Intensity. Very good, Neha Banu. Yeah, gravity. Strictness. Strictness. Severity, strictness. Depression. Write down the synonyms. Upset, worry, confusion, sadness, sorrow. Related words you write. Low spirits. Yeah, low mood. Very good. Yeah. Next one, 33. Hesitate. Hesitate. Hesitate means to do or not to do. Delay in taking decision. Not sure. Confused. Next one is 34. Need. These words will come lot of times. Need. Need. Require. Demand. Want. Expectation. Compulsion. Obligation. Necessity. Essential. Next one is 35. Overcome. What do you mean by overcome? Means successful. He overcame the situation, means he became successful. See, what all you are writing, those only will be there in the future questions. Overcome means victorious. Got rid of. Obstacle. See, another word got 36. Obstacle. Earlier we have learned a lot of words. Okay, obstacle. Obstacle means what? Obstacle. Obstruction. Limit. Boundaries, barriers, hindrances. Blockade. Stumbling block. Very good. Right. Hurdle. Very good. Next 37. Provide. Provide. Yeah, impediment. Very good words. Very good. Provide. Offer. See what we are doing, what others are doing. We are different. We are a different metal. We are not like those people who will go and fail in the exams. We will sharpen our weapons. Additional, more than required, extra, more than, abundant, surplus. Surplus, you know, most of you have heard these words. Surplus, excess. Information, knowledge, wisdom, data, knowledge, wisdom, data, information. Details, particulars. Particulars. Then incorporated, included, added, put in. Incorporated means put in, applied. Yeah, very good. Incorporated, very wonderful word. Input. Very good, very good. We're coming to the closure now. This is what is called learning. Without filling our brains, without filling the overhead tanks, you want to open the tap, nothing will come from there. First fill in your tank, overhead tank on the building, then only water in the kitchens and washrooms will work. Okay, you don't fill the overhead tank, it has already been emptied, nothing is going there. Nothing is there in only what is required, things are not there in the overhead tank, water. How can you open the tap and wash your vessels? So we are filling in the tank now. Inculcate. Right, okay. Next one. 41. Fields, suicide rates reduced, interventions, restrictions, finished, reduce, finished, access means reach, available, at hand, handy, can be approached. Handy, reachable, available, entry, entrance, way. Right, next one. Harmless. Okay, harmless, no need. Harm already we have seen. Next one, 44. Substances, materials, things. Substances, materials, things. Substances, things. Appliances, materials, objects, objects. Next one. See here, methods, approaches, strategies, techniques, ways, all finished. Include already over. Incorporated, including, see here. Try to understand how the words are repeated in a different way. Now, okay. Address means respond. Earlier we have seen answer, solution, address. See there, address means respond. Earlier we did not write. So, solution we said. Solution, answer. Okay. Address. See the word there. Therapies that address means therapies that solution, give solution to. Okay. So address means not just that address. Address means solve. Therapies that solve. Therapies that provide solutions. Therapies that answer. Problems means questions. Solution means answers. Addressing means answers, answering. Repetition means reoccurring. Recur. Repetition, 46. Repetition. Repetition, reoccur, reoccurrence, recur. R-E-C-U-R, recur. Reoccurrence. Repetition, repeating. Multiple. Repetition, multiple occurrences. Yeah, restate. Very good. Increasing. Now, In this, very few will be there. That's all. See here. Last week, one set you do like this, remaining will be easy. Okay. Increasing, we know already did. Concern, we already did. Okay. This is not necessary. Covering. Okay. Okay, that is not necessary. Many. Okay, this is very important. Many. Yes. 48. Many. Number of, numerous, several, innumerable, uncountable, various, multiple. Those who are serious, don't miss these evening sessions. Many gaps. Next one is 49, gap. Deficit, drawbacks. Lag. Wanting. Shortage. Lacking. Missing. Shortfall. Vulnerable. Very few words. See, vulnerable. Vulnerable means not strong. Easily can break. Weak, helpless, poor. Not strong. Yes, fragile. Meek. M-E-E-K, meek. Say provides, accessible, information, attempt, everything is there. Okay. Yes, that's it. So this is the way how you learn these things. Okay. Now I am going to play the audio and I'm going to show you the questions. You're going to do the answers. So before going there, so every day, only testing. Nothing is there, only testing. Today you are putting inside, everything putting inside. This is called transformation learning styles. Transforming learning styles. Yes. Now, I'm not telling anything. You learned 0 or you learned 100. What is grade you are learning today? How much did you learn? 0 or 100? You write your knowledge. What you gained today. Don't talk about me. Sir, you taught well that, this, I don't know what you learned, because I did not teach much today. I was just here. I'm a blackboard. I'm just a blackboard. You did all the action here. Come on, write down fast. 10 seconds. Ten seconds. Now these are put in your brain. Now these should go into your blood now. They should go into your veins. They should go into your arteries. They should go into your kidneys. They should go into your lungs and heart and everywhere. Just I put in your brain now. They should go everywhere. Do you know what is this activity called? Can anybody tell me? I will give you a chocolate. The type of activity we have done. Can you give one word label for one word label? One word label. Mona, you have almost close to that one. Almost close, Mona. I want it in one word. One word. One word. I don't want two words. This is actually a learning style. You did what you did is a very wonderful, high class learning style. No, 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 no. I'll keep my chocolate for myself. I'm giving you another 30 seconds. 30, 29, 28, 27, 26. One word I want. What activity we have given? One word. One word. Yes, Nasra. Nasra is right. But actually, it is one word. Nobody got the chocolate. It is B. Yeah, this is it. This is the word. I told one word. That is the word. Brainstorming is an activity or business method in which a group of people meet to suggest a lot of new ideas for possible development. That is what you have done. See the power of the word. One word brainstorming means what? How many words is equal to? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. So one word is equal to 22. Okay. 22 words. I told you you are very close. You missed it. Okay. Nobody wrote. So that is the word. Brainstorming means this is the word. So in this many words means one word, brainstorming. So the power of that word. But Nasra, you wrote two words, okay, not one word. You wrote it wrongly. Actually, it is wrong. Okay. Brainstorming is one word. You wrote two words. Okay. So we cannot say it is right. Okay. You wrote, but you wrote wrong. There is no word, two words, brainstorming. It's not right. It's wrong. So that's why. Okay. No problem. Don't cry. Don't cry. I'll give you tissues. Okay. A lot of tissues are there with me. Okay. I'll send through WhatsApp. No worry. Okay. Now, WhatsApp is making distances closer. Fine. Right. That's the powerful game. That's the powerful game. Come on, active. Get ready for shot put. You want to throw the shot put, no? That shot put ball should go far. You'll have a chain in the hand. You'll roll, 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 then go round, 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 and throw it out. That is called shot put. Okay. Javelin, you want to throw the javelin. You have to run long distance and throw the javelin. Bend back and throw it forward. High jump, long jump, triple jump, everything. Okay. High jump from here to here, you jump, you run almost 50 steps. Okay. So that is called hard work. Okay. Right. Now coming. Yes. Get ready. Yes. We have come to the dead end now.
Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36.
It is important to realise that 83% of people who commit suicide or attempt suicide have had contact with a doctor within a year of their death, and up to 66% of people who commit or attempt suicide have had such contact within a month of their death. Therefore, with better prevention techniques, these figures could be reduced. We can divide suicide prevention into three categories, which are primary, secondary, or tertiary. Secondary suicide prevention aims to decrease the likelihood of a suicide attempt in high-risk patients. Tertiary suicide prevention occurs in response to completed suicides and attempts to diminish suicide in a particular geographical area or in a particular age group. I would now like to look at secondary suicide prevention in more detail. Secondary suicide prevention is particularly important, but not always given the attention that it deserves, in part because research into secondary prevention is only just starting to be applied to clinical practice. Now, from a clinical perspective, suicide is often difficult to predict due to its complex nature. The three major risk factors that contribute to suicidal behaviour are biological, psychological, and proximal stresses, which are recent events that can lead to increased suicide risk. Firstly, there are biological risk factors for suicide, which include low blood cholesterol levels, medical or neurological illnesses such as multiple sclerosis, stroke, Huntington disease and epilepsy, cigarette smoking. Secondly, there are psychological risk factors which include a childhood history of physical or sexual abuse, aggressive personality traits, low self-esteem, and poor access to psychiatric treatment. Thirdly, there are proximal stresses, or the recent events that can lead to increased suicide risk, and these include relationship problems with a spouse, partner, or loved one, financial troubles caused by unemployment or large amounts of debt, a family history of suicide, major depression, and drug abuse. The clinical evaluation of the medical and psychiatric history of a patient and of their current state is the crucial and essential element of the suicide assessment process. It is important because it enables the identification of risk factors in order to determine the patient's immediate safety and the best setting for treatment, and also to develop diagnosis and treatment strategies. Psychiatric illness is a major contributing factor to suicide risk, with mood disorders such as major depressive disorder and bipolar disorder being associated with about 60% of suicides. Indeed, psychiatric disorders are diagnosed in more than 90% of completed suicides, and more than 80% of these psychiatric disorders are untreated. Thus, the recognition and treatment of individuals with psychiatric disorders, specifically mood disorders, are essential components of secondary suicide prevention. In addition, the subjective rating of the severity of depression is one of the most powerful predictors of future suicidal acts. Therefore, assessing and managing depression, as well as being aware of the suicide risks in psychologically, medically, and neurologically disordered individuals, is an important aspect of secondary suicide prevention. Consequently, physicians need to be taught to recognise the association between mental disorders and suicide. Additional information about the individual who may be at risk for suicide, such as medical and psychiatric treatment records and toxicology screenings, should also be incorporated into the assessment. Equally importantly, clinicians and other professionals in a position to offer help should not hesitate to ask patients about suicidal ideation because, while it may seem surprising, patients will often talk frankly about their suicidal thoughts and tendencies if given the opportunity. Failure to ask about suicidal ideation may be related to the health professional's discomfort with the topic, lack of time, or lack of skills in this area. Clinicians need to overcome these obstacles to provide appropriate care to their patients. What are the most effective secondary suicide prevention strategies? In a recent systematic review of suicide prevention strategies, Mann, along with other researchers, found evidence of effectiveness in 5 secondary suicide prevention methods, including pharmacological interventions, psychological interventions, follow-up care, reduced access to lethal means, and responsible media reporting of suicide. Antidepressant medications are the most widely used pharmacological interventions in secondary suicide prevention, but studies of their effectiveness in reducing suicide attempts have had mixed results. Among adults younger than 25, the effect of antidepressants seems to be neutral on suicidal behaviour, but it seems to reduce the risk of suicidal behaviour in the elderly. Thus, the relation between antidepressants and suicide needs further studies before this class of drugs can be safely used for the secondary prevention of suicide. In terms of psychological interventions, suicidal patients often benefit from therapies that address the repetition of suicidal thoughts and behaviours, and other factors commonly associated with suicide. Better psychological and pharmacological treatment of depression and alcoholism also appears to decrease suicide rates. Social factors that should be addressed in follow-up treatment include availability and willingness of supports within the family. Support individuals who should be contacted about the suicide risk and follow-up arrangements include general practitioners, private psychiatrists, family and friends. Some interventions, however, such as telephone and psychosocial follow-up, have shown no difference in suicidal ideation when compared with standard aftercare. Many studies show that suicides by particular methods, for example, firearms, domestic gas or pesticides, decrease after the introduction of legal restrictions that reduce access to such means. This reduction in suicide rates is particularly influential in regions where the specific means of restriction correlates with a common method of suicide. For example, in the UK, the reduction of carbon monoxide in domestic gas since 1958 and the reduced availability of analgesics since the mid-1990s have both decreased UK suicide rates. Finally, many studies have exposed a need for a decrease in reporting of suicide and for responsible reporting. Media blackouts in reporting suicide have coincided with a decrease in suicide rates because reports of suicide in the media tend to glamorize suicide for vulnerable individuals. The internet is also of increasing concern, with blogs and chat rooms providing accessible instructions for suicide. For these reasons, guidelines have recently been produced for the responsible reporting of suicide. Despite our increasing knowledge about secondary suicide prevention, there are still many gaps in the research, and looking to the future, thorough evaluations and appropriate treatments of patients with depressive disorders and other psychiatric illnesses should help to improve the efficacy of secondary prevention of suicide. But it is also clear that more research into new approaches for the prevention and treatment of suicidal behaviour remains essential.
Okay. Now what I
Now look at Extract 2.
have done is
Extract 2. Questions
given
36.
you an option to go through that individually. Right. Now I'm going to give you in a different style. Yes. Yeah. So just check it out and let me know whether it is clear for you or not. Mona, your video is on. I did not give you permission to start your video. Yes, is the screen clear? Just one or two people say yes, if it is clear. Okay, fine. So the entire screen is here. Now, this is how it will be there.
7 to 42. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36.
It is important to realise that 83% of people who commit suicide or attempt suicide have had contact with a doctor within a year of their death, and up to 66% of people who commit or attempt suicide have had such contact within a month of their death. Therefore, with better prevention techniques, these figures could be reduced. We can divide suicide prevention into 3 categories, which are primary, secondary, or tertiary. Secondary suicide prevention aims to decrease the likelihood of a suicide attempt in high-risk patients. Tertiary suicide prevention occurs in response to completed suicides and attempts to diminish suicide in a particular geographical area or in a particular age group. I would now like to look at secondary suicide prevention in more detail. Secondary suicide prevention is particularly important, but not always given the attention that it deserves, in part because research into secondary prevention is only just starting to be applied to clinical practice. Now, from a clinical perspective, suicide is often difficult to predict due to its complex nature. The 3 major risk factors that contribute to suicidal behaviour are biological, psychological, and proximal stresses, which are recent events that can lead to increased suicide risk. Firstly, there are biological risk factors for suicide, which include low blood cholesterol levels, medical or neurological illnesses such as multiple sclerosis, stroke, Huntington disease and epilepsy, cigarette smoking. Secondly, there are psychological risk factors which include a childhood history of physical or sexual abuse, aggressive personality traits, low self-esteem, and poor access to psychiatric treatment. Thirdly, there are proximal stresses, or the recent events that can lead to increased suicide risk, and these include relationship problems with a spouse, partner, or loved one, financial troubles caused by unemployment or large amounts of debt, a family history of suicide, major depression, and drug abuse. The clinical evaluation of the medical and psychiatric history of a patient and of their current state is the crucial and essential element of the suicide assessment process. It is important because it enables the identification of risk factors in order to determine the patient's immediate safety and the best setting for treatment, and also to develop diagnosis and treatment strategies. Psychiatric illness is a major contributing factor to suicide risk, with mood disorders such as major depressive disorder and bipolar disorder being associated with about 60% of suicides. Indeed, psychiatric disorders are diagnosed in more than 90% of completed suicides, and more than 80% of these psychiatric disorders are untreated. Thus, the recognition and treatment of individuals with psychiatric disorders, specifically mood disorders, are essential components of secondary suicide prevention. In addition, the subjective rating of the severity of depression is one of the most powerful predictors of future suicidal acts. Therefore, assessing and managing depression, as well as being aware of the suicide risks in psychologically, medically, and neurologically disordered individuals, is an important aspect of secondary suicide prevention. Consequently, physicians need to be taught to recognise the association between mental disorders and suicide. Additional information about the individual who may be at risk for suicide, such as medical and psychiatric treatment records and toxicology screenings, should also be incorporated into the assessment. Equally importantly, clinicians and other professionals in a position to offer help should not hesitate to ask patients about suicidal ideation because, while it may seem surprising, patients will often talk frankly about their suicidal thoughts and tendencies if given the opportunity. Failure to ask about suicidal ideation may be related to the health professional's discomfort with the topic, lack of time, or lack of skills in this area. Clinicians need to overcome these obstacles to provide appropriate care to their patients. What are the most effective secondary suicide prevention strategies? In a recent systematic review of suicide prevention strategies, Mann, along with other researchers, found evidence of effectiveness in 5 secondary suicide prevention methods, including pharmacological interventions, psychological interventions, follow-up care, reduced access to lethal means, and responsible media reporting of suicide. Antidepressant medications are the most widely used pharmacological interventions in secondary suicide prevention, but studies of their effectiveness in reducing suicide attempts have had mixed results. Among adults younger than 25, the effect of antidepressants seems to be neutral on suicidal behaviour, but it seems to reduce the risk of suicidal behaviour in the elderly. Thus, the relation between antidepressants and suicide needs further studies before this class of drugs can be safely used for the secondary prevention of suicide. In terms of psychological interventions, suicidal patients often benefit from therapies that address the repetition of suicidal thoughts and behaviours, and other factors commonly associated with suicide. Better psychological and pharmacological treatment of depression and alcoholism also appears to decrease suicide rates. Social factors that should be addressed in follow-up treatment include availability and willingness of supports within the family. Support individuals who should be contacted about the suicide risk and follow-up arrangements include general practitioners, private psychiatrists, family and friends. Some interventions, however, such as telephone and psychosocial follow-up, have shown no difference in suicidal ideation when compared with standard aftercare. Many studies show that suicides by particular methods, for example, firearms, domestic gas or pesticides, decrease after the introduction of legal restrictions that reduce access to such means. This reduction in suicide rates is particularly influential in regions where the specific means of restriction correlates with a common method of suicide. For example, in the UK, the reduction of carbon monoxide in domestic gas since 1958 and the reduced availability of analgesics since the mid-1990s have both decreased UK suicide rates. Finally, many studies have exposed a need for a decrease in reporting of suicide and for responsible reporting. Media blackouts in reporting suicide have coincided with a decrease in suicide rates because reports of suicide in the media tend to glamorize suicide for vulnerable individuals. The internet is also of increasing concern, with blogs and chat rooms providing accessible instructions for suicide. For these reasons, guidelines have recently been produced for the responsible reporting of suicide. Despite our increasing knowledge about secondary suicide prevention, there are still many gaps in the research, and looking to the future, thorough evaluations and appropriate treatments of patients with depressive disorders and other psychiatric illnesses should help to improve the efficacy of secondary prevention of suicide. But it is also clear that more research into new approaches for the prevention and treatment of suicidal behaviour remains essential.
Now look at Extract 2. Extract 2, questions 37.
Yes. Now let us see this one. Now let us get the answers. Now question number 31. Question 31. Yes, submit your answers. Question number 31. Submit your answers. Yes, submit your answer. 7, 6, 5, 4, 3, 2, 1. Submit your answer. That is, this is the answer. 31 is a C. 31 is C. 31 is C. Next. Next one is 32. So 32 is here. 32 is here. Yeah, this is 32. Yes. Question number 32. Yes, submit your answer. Question number 32. Understated means another meaning is underestimated. Not given much information. Come on, write down your answers. Six people have given the answer. Whatever there is 7. 4 are the 8. 9. Okay. Thirty-two is A. 32 is A. 32 is A. Okay. Who wrote A? Rakil. Then next one is Marana. Okay. Meera. 3 people have written. So Meera, Rakil, and Marana. Okay. They have written A. Now next one, 35. Sorry, 33. 33. Yes. 33. Question number 30. Question 33. Yes. Submit your answer, please. Question number 33. Yeah. 33. 33 is B. 33 is B. Next, 34 is here. Question number 34. So let me write first. Question 34. Yeah. You can submit your answer. Question number 34. Question number 34. Okay. Thirty-four is A. 34 is A. 34 is A. Next, 35. Wait, let me write. Question 35. Yes, write down your answer. Question number 35. Question number 35. Question number 35 is C. Question number 35 is C. Okay. Next. Question number 36. Question number 36. Yes. Thirty-six is C. Okay, 36 is C. 36 is C. Now, total score out of 6. You can submit. Total score out of 6. Constance Mafosa, 4/6. Meera Manoj, 6/6. Laraib Adil, 3/6. Envy Jacob, 4/6. Sangeeta Patel, 4/6. What about the others? Shefali, 2/6. Raket, 2/6. Okay, these are the areas, problem areas. Okay. These are the problem areas. So what is the main problem is they will speak all the three. They will speak about all the three problems, but there will be a twister which connects to the main problem. Okay. So that's very good. So that's the end of the session today. And tomorrow we'll be doing reading. And after tomorrow we'll be doing both reading one, listening one. So 25th test, we have one reading and one listening. Both of them we do because tomorrow we don't have any explanation part. So we'll just do the test and we'll find out why these answers are wrong and why these answers are right before going to the next one. So before closing, so give your feedback in 1 or 2 sentences. Give your feedback in 1 or 2 sentences. I don't know, dear, South Africa, what time it is, but 6 p.m. in India. So you have to check it out. South Africa. Which zone? South Africa, Africa time or India time is 6 p.m. So let me show you the time. The time comparison. Time comparison, convert time zones. So what are the time zones you can see? India. So this is my time, Indian time. Okay. So which time you want, you have to check there. So this one is South Africa time, huh? Africa time. I don't know which zone you are, Africa time. So this is Africa time, Lesotho time, huh? Lesotho. Which area, which country you are? Write down. Lesotho. This is Lesotho time. So this is the difference. Namibia. Okay. Namibia. Namibia. So 2351. 2051. You're just now here it is. Lesotho it is 821. And here it is 2351. So you can understand the difference. This is the difference. So 820, 920, 1020, 1120. 3 hours, 3.5 hours difference. Okay, we are 3.5 hours early. So Indian time 6 o'clock means for you 2:30, I think. 2:30. So this reading and listening are very tough. So that's why I did not correct the letters. So tomorrow morning I'm going to correct all the letters because I have to do a lot of background work for this reading and listening. So totally exhausted. I'm totally exhausted. So what you can do is, fine. Tomorrow morning I'll be correcting the letters. Evening, no explanation tomorrow. So just going to analyze the questions. That's all. So give your feedback for the session. So if you want to know the time zones, you can find out here. Okay, history, time zones. Okay, this is the link. This is the link I'm giving you. You check this link. Check this link. Then it will take you directly there, time zone. So you can just write here, India. Okay. And your place. Whatever place is there, you can just check it out. And we check up, very good. Okay. Anvi, Binsi, Constance, Laraya, Marna, Meera, Sangeeta, Shifa, they are all regular students. Good. Fine. I really appreciate your hard work. So I'm just giving you 1 minute more. After I'll close. If you want to write anything, type your feedback or anything, you can close it. Just 1 minute. Yes. Yes, Larab, these are for you people only, especially for those who are going for the exams. Yeah. So 7, 6, 5, 4, 3, 2, 1, done. Copy. Good night.